Hey, what's up, guys? This is Umang. I'm a strength and condition coach, and I've been training athletes as well as general fitness clients for about 5 years now. Now, in this video, we're going to be talking about some running injuries, some common running injuries, as well as I'll be teaching you certain exercises which you can use to recover from these injuries. And you can also incorporate these exercises in your routine to, just to make sure that any of these injuries don't happen to you in future. Now, without wasting any more time, let's see what these injuries are, and then we'll dive into the exercise part. All right, so the first one on our list is Achilles tendonitis. Now, this injury is an acute overuse injury that leads to or that causes pain on your Achilles tendon, that is on the back of your ankle. Now, as I said, this is an acute injury, but it can also become a chronic injury. It can also become a chronic injury called tendinosis if you keep putting pressure or if you keep putting stress on your Achilles tendon over a very long period of time. And this tendinosis can further become tendinopathy. So my advice would be, if you're experiencing pain, go see a physician or a physical therapist as soon as you can. Now, with that out of the way, let's talk about what causes it. All right. Now, as I said, it is an overuse injury. So overusing or doing high impact exercises for a very long period of time without incorporating proper rest days and rest periods can lead to this. Next thing is running on uneven surfaces, running on hard surfaces for a long time, or not wearing proper shoes can also lead to this problem. All right. Also, if you're having tight calf muscles and hamstring muscles, or if you're having weak surrounding area of your Achilles tendon, that can also lead to this problem. So what do we need to treat it? All right. Now we know what causes it. It's time to learn about what do we need to treat it. If you're experiencing pain, if you're experiencing even a slightest bit of pain on your Achilles tendon or on the back of your ankle, take rest. Give it a rest. Take a break for a short while until the process starts, the area starts to heal itself. Then, if you're in order to subside the inflammation, in order to reduce the pain, try ice massage or ice therapy, right? At least twice a day. And once the pain subsides, once the pain is gone completely, or it's next to negligible, next to minimum, then try these exercises that I'm going to demonstrate you now. All right, now, if you're experiencing Achilles tendonitis, then these are the two exercises that you need to incorporate in your routine. The first one is heel lift. All you need to do is just stand straight, look forward, stabilize your body, and then lift your heel. If you're a novice, then you can also take support from a wall. Otherwise, just hold it for 2 seconds, count till 1, 2, then go down gently. And again, repeat the same procedure. Hold it for 2 seconds, count till 1, 2, then go down. Now you need to repeat this particular movement for at least 10 to 12 times for at least 3 sets. Okay, now the next exercise that we're going to be doing is calf static stretch. Now this exercise can be done in a number of different ways. I'm going to show you one way. Just try this out and do this for at least 3 sets and hold for at least 20 to 30 seconds in each set. Okay, now all you have to do is just stand straight, put one leg in front, stabilize your body, lift up your toe, lift up your front toe, and then bend your upper body in the forward direction. Now, at what point do you need to hold the stretch? At point where you feel a minor discomfort. That's it. Hold the stretch for 15 to 20 seconds. Come up, come back down, then repeat it for the other leg. Now, you can also do this exercise while taking a support from a wall. All right, so the next one on our list is iliotibial band syndrome, IT band syndrome, right? This one is also an overuse injury. Again, emphasis on overuse. It is an overuse injury, but this time you experience pain on the band connecting from your lateral hip to your lateral knee, right? You experience pain mostly on the lateral side of your knee, right up of your knee. All right, now let's talk about what causes it, right? The first thing is it's an overuse injury. So overusing or running for a very long time, prolonged time, right? Without incorporating proper rest days and rest period can lead to this. So stop overusing or stop overdoing any exercise. Stop overexerting yourself. Second thing is running on hard surfaces for a prolonged time, running on uneven surfaces at all, and not wearing proper running shoes can also lead to this problem. But the most important one that you need to understand is if you're running on circles, let's say on a track, tracker. If you're running on circles in same direction, can lead to this problem. So make sure you start running either linear or you start running, in the opposite direction as well. So mix it up. Don't run in the same direction for a very long time. Okay, now we know what causes it. So how do we treat it? First, rest. If you're experiencing pain, take some time off, take a break, take some rest. Take proper rest as to, start the healing process again. So that immobilize your leg for a couple of days. Then ice it. Ice is your best friend in this scenario as well. If you're experiencing pain, ice massage and ice therapy twice a day can be really beneficial. And once the pain subsides, I'm going to be demonstrating certain exercises. Try them out. Now, what do we need to do if you are experiencing pain from iliotibial band syndrome, IT band syndrome? All right, so I'm going to show you a couple of things, right? But the first, let's talk about foam rolling, right? If you have a foam roller at your home or at your gym or at your nearby health club, you can do foam rolling as well, but do not apply pressure on the pain area. But if you do not have a foam roller, you can also try this stretch. Okay, now stand straight, look forward, stabilize your body, put one leg in front, cross that leg. Now you need to bend sideways. Now you need to bend on the direction. Let's say if your right leg is in the forward direction, you need to bend right way. So right side. You need to bend on the right side like this. Now you need to hold the stretch for at least 15 to 20 seconds each side. Remember, if your right leg is in the front, then you need to bend right side. If your left leg is in the front, you need to bend left side. So the next injury that we're going to talk about is medial tibial stress syndrome, aka shin splints. Now this is a very, very, very common injury amongst runners, and in this one you experience pain on your medial distal tibia. That is, on the lower part of your leg, the front side, you experience this pain. Now this injury or this pain is mostly associated with exercises or during exercises, but if the injury gets worse or progresses, then you might find or you might experience pain during rest too. So now with that out of the way, what causes it? Well, let's talk about what causes this problem, right? Again, it's an overuse injury, right? So overusing or overdoing any particular exercise or running tactic can lead to this problem. Second, running on hard surfaces. Again, the ones we were talking about so far, right? Hard surfaces or running on uneven surfaces, not wearing proper shoes. These are some common things that you need to take care of before getting into a fitness regime or a running fitness regime. All right. Next thing is having tight hip muscles, having weak or having muscle imbalances on your hip area or on your lower part of your leg, on the lower part of your leg. Okay. Now, what do we do to treat it? Now, what do we do to treat it? You start with rest and ice. As always, if it's an overuse injury or if it's a stress-related injury or if it's a exercise-induced injury, start with rest and ice. Those are two of your best friends, all right? Then, once that is done, once your pain subsides, start with these exercises that I'm going to demonstrate you now. If you are experiencing pain on the medial distal tibia, that is on your shins, right? Then these are the exercises that you need to do. The first exercise is your strengthening of the anterior tibialis, right? All you need to do is just take support of a wall, put one leg in the air, in the front, right? And pull or dorsiflex your ankle like this. Relax like this. Relax like this. Now, you need to do this exercise for each leg 12 times each for at least 3 sets. Okay, now the next exercise is your calf static stretch. For the calf static stretch, just bend sideways, lift your toe, keep your heel on the ground, keep your both heels on the ground. Your heels should be touching the ground. Now, bend forward, bend slightly forward and hold the position where you feel a minor discomfort. Hold it for 15 to 30 seconds. And then switch it to the other leg. So the next point or the next injury that we're going to talk about is patellofemoral pain syndrome, aka runner's knee. Now in this one, you experience pain in the front of your knee, behind the kneecap, as well as you might experience some tenderness around the knee as well. Okay. Now this pain is usually worse when climbing upstairs or going up hills. All right. Now what causes it? What causes this problem? Again, some of the common points are overusing, running on hard surfaces, uneven surfaces, and not wearing proper shoes, all right? But the most important one is hyperextension of the knee. Too many heel strikes, right? That's why your coach or anyone, you might have also heard this, right? You must have also heard this, whenever you run, you should run on your toes, not on your heels, all right? Because excessive heel strike can lead to this problem. Now that we know what causes it, how do we treat it? Always start with rest and ice. And once the pain subsides, start with strengthening and stretching your front thigh muscles as well as hip muscles. All right, I'll be showing you certain exercises that you can incorporate in your normal routine or in a fitness regime to, recover from this injury. Okay, lie down. Keep one leg straight, one leg bent. All right. Now, lift up that straight leg up in the air. Hold it at the 45-degree for 5 seconds. 1, 2, 3, 4, 5. Come down. Repeat the same procedure one more time. 1, 2, 3, 4, 5. Come down. Now, you need to do this exercise for at least 10 repetitions and 3 sets with both legs. Okay. Now, the next exercise that you need to do is side leg lift. Okay. Just lie down. Lie down like this. Keep one leg on the top of each other. Keep one leg on top of the other one. Then lift up your leg. Lift up your leg. Hold it for 5 seconds. 1, 2, 3, 4, 5. Down. One more time. 1, 2, 3, 4, 5. Again, you need to do this exercise for at least 5 times, and hold it for 5 seconds each time, and you need to do it for 3 sets with each leg. All right, so the next exercise that we're going to be doing is prone hip extension. All you have to do is just lie down, face down. All right, now lift up your one leg up, hold it for 5 seconds. 1, 2, 3, 4, 5. Down. Do it one more time. 1, 2, 3, 4, 5. Now, again for this exercise too, you need to do this at least 5 to 10 times. Hold it for 5 seconds each, and you need to do it with both legs, 3 sets each. So the next injury that we're going to talk about is plantar fasciitis. Now, plantar fasciitis means inflammation of plantar fascia. All right. Now, this pain is usually worse when you wake up in the morning and when you take your first few steps, and when you stand up and when you take your first few steps after an extended period of sitting. All right. Now, this pain, especially on the plantar fascia runs from the calcaneus bone to the phalanges of your foot that maintains the arc. All right. Now, let's talk about what causes it. Again, it's an overuse injury. So make sure that you do not do exercises without incorporating proper rest period. All right, proper, not just exercising, but also your running. Okay. Now, next, again, the most common things, running on uneven surfaces, on hard surfaces, running barefoot or walking barefoot for a very long time, and having tight calf and hamstring muscles, or Achilles tendon for that matter. All right. And the most important one in this scenario is having a flat foot. If you do not have enough arc, all right, and if you have an excessive foot pronation, then you need to do something about it. You need to do something about that first. Okay. Now let's talk about how do we treat it. What do we do to correct it? First, again, if you're experiencing pain on your plantar fascia or on the bottom of your foot, start with some rest. And ice. Okay. All right. Now then, once the pain subsides, I'm going to be demonstrating certain exercises. Try these exercises at least once a day, or you can incorporate these exercises in your fitness regime. You should be fine. Now, if you're suffering from plantar fasciitis, these are the 2 exercises that you need to do. Absolutely need to do. All right. One is the calf static stretch that I've showed earlier. All you need to do is just put your one leg in front, lift up your toe, and then bend your upper body forward. Stretch it. Hold it for 15 to 20 seconds at a point where you feel a minor discomfort. That's it. Now, repeat it for both legs. Now, repeat it for both legs at least for 3 sets, 15 to 20 seconds hold in each set. Okay. Next exercise that you need to do is hamstring static stretch. Stand straight, all right, and then try to touch your feet. Bend forward, keep your knees straight and try to touch your feet. Hold it at a point. If it doesn't really matter if you touch your feet or not. All you need to do is just bend down and hold a point where you feel a minor discomfort. So even for this stretch, hamstring static stretch, you need to hold each stretch for at least 15 to 20 seconds, and you need to do it for 3 sets. So the next injury that we're going to talk about is sprained ankle. Now this is a very common amongst everyone, right? Now in this injury, right, how do we get this injury? Either we are running on a slippery surface, we twist our leg, right? We turn our leg, or we tear the ligament that stabilizes our ankle. Any of these things, any of these scenarios can lead to this problem. Okay, so again, as I said, what causes it? Bad fall, or running on a slippery surface or on an uneven surface, or by mistake we just twisted our ankle. That can lead to this problem. Any number of these things can lead to this problem. So what do we do to treat it? Again, it's an overuse injury, it's a running injury, it's a sports injury. So start with rest and ice. Okay, start with the rest and ice. Those are again your best friends. Once the pain subsides, I'm going to be demonstrating certain strengthening exercises for your ankle. All right, you can try those exercises, or you can incorporate these exercises in your fitness regime so that it can never happen again. All right, so for this last injury, sprained ankle, you need to do these 4 exercises, starting with ankle dorsiflexion. All you need to do is just sit straight, lift up your leg, and pull your ankle in the front. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, just like this, you need to repeat it for the other leg too. For same 3 sets and 10 to 12 repetitions. All right, so the next exercise that you need to do is ankle plantar flexion. Now, in the last one, we were pulling our ankle towards us, right? In this one, we need to push it, all right? Like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, you need to do this exercise for 3 sets, 10 to 12 repetitions each. So the next exercise that we're going to be doing is called ankle eversion and inversion. Now for this too, you need to sit straight, keep your legs in front, lift up your leg and rotate it inwards first and then outwards next. Inwards, outwards. Now let's do it after me, all right? Lift up your leg, inwards, outwards, inwards, outwards, inwards, outwards, inwards, outwards. Again, for this exercise too, you need to perform this exercise at least 10 times inwards and 10 times outwards for each leg for at least 3 sets. Alright guys, so those were some common running injuries as well as some exercises, right, you can use to recover from those injuries. But now again, make sure that you incorporate these exercises in your general fitness training too, so that you don't have to face these injuries over and over again.